do want to introduce Dr. Rob Winn. Rob is the medical director at Mazzoni Center, and he's going to sort of bring it down to the ground level. He is someone who is practicing medicine on the ground level, dealing with the LGBT community on a daily basis, and we've asked him to talk about some of the obstacles and barriers that members of our community may face in accessing healthcare today.
Thank you. I am Rob Winn, and I am a family medicine doctor at Mazzoni Center. I'm also a faculty member at Thomas Jefferson University. And I bring that up to say that I'd like to be able to say in 2010 that we don't need LGBT-specific health care, that we, just like everybody else in the community, can go to a doctor or physician assistant or what have you and get care that's just like everybody else. But unfortunately, that's not true in 2010. And so the crusade goes on to make people understand that LGBT folks are in every practice, that are in every office, and that most of what we need is similar to everyone else. But there are definitely exceptions. And I'm glad that you brought up access, both of you, as one of the issues, because in thinking about what I was going to speak on today, I wanted to think about what the reason that people come to me the most is, and that is because they feel like they have nowhere else to go. We at Mazzoni are proud to be able to provide people care without regard to health insurance, and we do that in a very careful way, in a very accurate way. However, there are limitations. If you don't have health insurance and you need an x-ray, that is an incredibly expensive thing to get done. If you need something like an MRI, it's nearly impossible to pay thousands of dollars for that. So access becomes one of the major issues for our patients. If you're young and healthy, you can probably skirt by, but as soon as you have a disease process, be that HIV or some other disease process, it becomes out of the realm of possibility. The other piece of access has to do with pre-existing illness. If you have no health insurance and you come to me and we figure out that you have diabetes or some sort of cancer, and then you try to access health care because you have the opportunity, sometimes you're denied that. And so one of the things about this bill that is going to be crucial to a lot of my patients is being able to say, yes, I have a disease and I don't need to find a way to hide that in order for me to have access to health care later. And then finally, the cost for people with HIV, for instance, even if they could get the access to care to me, if they get prescribed a medication, like an HIV medication, it's virtually impossible for someone who doesn't make a lot of money to pay for that, because the medications can be thousands of dollars a month. $1,500 is a usual regimen amount per month. If you add that up over 12 months, that takes away most people's income. And then finally, and hopefully this will be addressed at some point, is, as you mentioned, the way that people access healthcare mostly is through work or through a partner. And thankfully, if you work for a place like Jefferson that offers domestic partner benefits, then you might have access to that through your partner. But so many of my patients don't have that. They are the person in the relationship who either doesn't work or doesn't have access to insurance, and they can't get it through their partner. And so until we start to include domestic partnership, not having a requirement of marriage as a prerequisite for that, a lot of people are going to not have access to the care. In addition to the access, I just wanted to talk a little bit about culturally competent care. As I said, LGBT folks should be able to get care anywhere, but we do have specific issues that are individual or related just to us. And when I teach medical students, I often find that unless they're from the community, it's often never occurred to them. And if I'm not there to give my 3 hours of lecture during their 4 years of medical school, they may not hear it at all in their 4 years of medical school. So I proudly do that. I offer my 3 hours. I also run small groups, and thankfully for the 10 students in my small group, they'll probably hear more about LGBT health than they ever want to hear in their life. They'll be educated about it. And unless you're aware of someone's sexuality or gender identity, then you're not going to be able to address those issues. So it comes down to some things you've mentioned before. Language. Do you know how to speak to LGBT folks, in particular for transgender folks? That's the one area that I feel like most people get no education in medical training. So I proudly try to teach people about that as well. But it's not just the language, it's the exclusion from the minute you walk in the door. If you call for an appointment and you're not addressed as the right gender, if you're asked to fill out forms and they don't have any choices for you, if you're a trans person, you're immediately excluded. And what I find is that many trans people don't seek care because it's not comfortable. And if they do seek care, it's uncomfortable to get that care. And then finally, we don't have enough people doing that work. We don't have enough people out there who can provide culturally competent LGBT care, but specifically transgender care, because we don't have the training out there. And so we at Mazzoni try to provide that as best we can, but we are one center with a handful of people working there, and we can't provide the care to everyone. And honestly, we should be able to have everyone in this audience go somewhere besides Mazzoni. I'd love to have you there, but I'd also like to have you at any of my colleagues' practices across the community. And so as I look out across this group, I see people that are my patients. I see people who probably don't have health care at all, and they don't go to a doctor at all, and that's unfortunate. And then hopefully what I see are people that have found a practice out there in our community in Philadelphia where they can get culturally competent care at a price they can afford with or without insurance.